Welcome to a special edition of Medicine in Meadville. I'm Dwayne Kohler from Meadville Medical Center, and we are in Titusville today, and we're going to talk about some big renovation projects that are going on here. The Titusville Emergency Department is in line for a big project, and we'll talk to the medical director and the head nurse and the person from the foundation who's running all that. But let me just catch up on a couple things going on with our Medicine in Meadville series. We certainly want to cover Titusville topics because there's a lot going on here. But our Ask the Expert, the community conversation series, that continues this year. We have one coming up here very soon on living wills. There's one on bodybuilding and one on fetal alcohol syndrome that's going to finish out this year, and the schedule is underway now for next year. So we want the show to have a combination of interviews and then those presentations from experts. So we'll be continue to having both things for you. Okay, so today we're going to talk about this big remodeling project that's just getting off the ground here in Titusville for the emergency department. So stay tuned, interesting show for you today. And joining us now, Kim Combs. Kim, welcome to the Medicine in Meadville. I want to talk about that for a second, the name for a second. Dr. Lawrence Newhook.
Hello.
So we're here talking about a big projects going on here at Titusville. So tell us about it, if you would.
Beginning in August of 2018, we're hoping to do a complete renovation of the emergency room, private rooms instead of curtains, and expanding our area for a better flow for the patients and their families.
So Meadville and Titusville are partners now, and so our show is called Medicine in Meadville, but certainly Titusville is a huge part of our audience, and we're happy to be here from time to time, and we hope to come more often and talk about things. But this was really exciting when I heard about this project going on. So talk about the ER in general. How's it going? I know about 2 or 3 years ago, urgent care started here in Titusville, so I want to ask you about that too, Dr. North.
But express care.
Well, let's start with that. So how's that going?
From what I understand, it's providing an excellent service for the community. People are having expanded access to care for some of the less serious complaints and illnesses that can be cared for in that type of setting. And I understand it's being received very favorably.
So urgent care, now this is going to be a personal bias of mine, but we have our community health needs assessment that's required of the hospitals to do that, and ask people about their doctor, and who's your doctor? Well, whoever's on call at urgent care, that's who my doctor is. I mean, not this, again, personal bias. I think people ought to have a doctor and keep in touch with a doctor over time.
Absolutely. For continuity of care, I think it's absolutely necessary.
To me, that's the captain of the ship. That's the one that's going to keep. If you have to see a specialist here or there or whatever, it's important to have somebody to check in with all the time. Mm-hmm. So, urgent care is a great thing to have. I think, as you said, it adds a component that maybe didn't exist before. Yeah. But you really need to have somebody that you're in touch with. In my opinion, that you're in touch with all the time. So you and I definitely agree about that.
Absolutely, that's absolutely mandatory. The urgent cares and these walk-in clinics, etc., they provide a service where perhaps it isn't possible for the patient to get an expedient appointment with their own PCP. And if it's something that requires perhaps a lower level of care, that they just need a script or a note or something, they can go to one of these centers and have that service provided.
Let me throw you a statement and have you react to it. Well, I just, I don't need to be at the doctor all the time. I just got this rash. I just need someone to look at this rash to get it taken care of or whatever. What would you say to that one?
I think, certainly depending on the nature of the rash and the duration, etc., it could be appropriate to have something of that nature seen in an urgent care or express care setting where it can be appropriately managed and then referred back to the PCP for continued care.
In my case, my doctor knows I like doing outdoor stuff. I'm not doing things outside all the time, and there's poison ivy at my property where I'm working all the time, and I call her on the phone and say, oh, you got poison ivy again? Okay, let me call you a prescription in. So I don't have to go see anybody. I mean, so we've got this history, and the understanding's already out there. She calls a pharmacy, I go get my whatever the cream is, I forget what it is, and that seems to help. So I mean, to me, from a customer's perspective, there's an advantage to having that kind of regular relationship and them knowing my history and all that stuff. So, well, what's the status of the ER now, and what are kind of the key components of the upgrade of the renovation that's going to go on?
The emergency room right now, we have 6 rooms, and we would like to add another room and possibly a couple fast track areas so that we can treat the patients that come in with the simple things that don't need a room for a lot of testing, that they just need to be seen by the physician and given a prescription, and then they can go on their way. That will speed things up. Our ER, both Dr. Newhook and I just started in July as the director. He's the medical director, I'm the nursing director. And in the past year, we've reduced our wait times. Wait time to see the physician has gone down. Our wait times overall in the ER, people are getting through more quickly. And the renovation should improve that more, it will ease the flow through the ER.
What kind of things did you have to do to make it so people could get to see? I mean, a huge frustration, I'm sure, for customers to come in and, you know, I'm not sure what all the stuff is that's going on and how come I had to wait 40 minutes to see the doctor and all that kind of stuff. How'd you make it happen so far to make the improvements? And well, then let me follow that up with another question.
We've worked with lab and radiology to improve the time till testing. We've just made the nursing and physicians more aware that we need to see the patient more quickly, get the testing started, so the process is just, it's been an awareness on the part of the staff to move things along more quickly.
When you come to the emergency room, you're probably going to need to get some tests no matter what. Am I right about that? I mean, you're probably going to get some lab tests, you're probably going to get some radiology exams, and of course it's obviously going to depend on why the person's coming, but
Exactly.
So it's not just coming and seeing you, and you know, we got to get to the bottom of what's going on, right?
Exactly. It's a it's a team approach. It's like a coordination of care that everybody is working for the benefit of the patient.
I know at the Meadville Medical Center ER, the CAT scan seemed like it was getting used more and more and more, to the point now where I think it's pretty much, there's one dedicated almost completely to the ER. It's just right around the corner. Are there certain pieces of equipment that you need to get as part of this project, or are the pieces already there and you just kind of streamline things with the way things operate, the way things flow, I guess would be what I'm asking.
For the most part, we're just going to streamline the way things flow. We've been adding equipment already. We've added an ultrasound machine dedicated to the ER that we didn't have prior to this summer. And we're going to upgrade some of our equipment that just as part of the project, we're going to put in new monitors, some new other pieces of equipment that need to be upgraded that have just, they're outdated.
Well, people can help with this too, and we'll talk about that after a bit, but let me ask you a question that comes up to me a fair bit. So when do I go to my doctor? When do I go to urgent care? When do I go to the ER? Is there you know, like a hard and fast rule about those things, or just even just some general ideas that we could throw out there to folks to, which is the right place, which is the most appropriate place for me?
Well, I think the most appropriate place would always be to see your family physician.
So start there with it, even if it's a phone call?
Care. And if you can, are informed that perhaps an appointment isn't readily available, then you can make a decision as to whether you would go to the emergency room or go to an urgent care. Well, then it becomes a decision of the magnitude of the illness or injury. Certainly urgent cares are quite capable of taking care of most minor illnesses and injuries as well. Illnesses such as coughs, colds, sore throat, earaches, chest congestion, maybe even nausea and vomiting to a degree where they could even receive fluid hydration. But if you have an illness that is more worrisome, such as chest pain that's radiating into your back or your neck or your arm, or shortness of breath that's so profound that you feel that you can't get your breath, or you're having perhaps a weakness of an extremity, a headache, a neurologic symptom that may forebode something like a stroke, then by all means you need to be in an emergency room and perhaps by ambulance. So it's almost a prudent layperson decision as to where the best place to go is, and I think people are more aware that certain things are appropriately managed in an urgent care now because they're so common in the United States right now.
You led me right to something else I wanted to ask you about. When do I drive myself or drive my spouse or whatever, or when do I call the ambulance? I mean, is there a way to make that call that's
Again, it's almost like the prudent layperson has to make that decision themselves. But certainly, if you're facing a potentially life-threatening illness, you need to be in an ambulance where there are skilled providers that can take care of you immediately administer medications immediately, provide medications en route to the hospital, be in contact with the hospital physician who could instruct care further while they're driving there. It's far more safer.
So I twisted my
Far more
ankle
safe.
and it's been hurting, and it's hurting a little bit more now. So that's different than I'm having chest pain. I'm having, this thing that might be a symptom of a stroke. I'm having severe abdominal pain. Those kind of things.
Absolutely, and,
Okay.
and then you also have to be aware as a public that there's only a limited amount of services, particularly ambulance services. So you don't want to be tying up an ambulance service for a lesser injury when someone who is really in extremis would need it, and it wouldn't be available because it was tied up. So everybody has a responsibility to make an appropriate decision.
Is there a, let's see, what's the word? Round the clock kind of an issue here to throw in here. I wake up in the middle of the night and this thing's hurting me, or this issue has kind of come on quickly, versus I've had this sore throat, then it got a little bit worse, and it got a little bit worse, and is there a how quickly it came on, and it came on at a I was trying to sleep at the time. I wasn't doing something to strain something or whatever. Is that a factor in?
Well, certainly it does seem that more serious illnesses occur during the night and are such that they will even wake you from sleep. But also, even I wanted to say even things like abdominal pain, like gallbladder pain, is notorious for occurring during the night, and babies are always born at 2 a.m. But so things that wake you up in the night are often pretty serious.
And so that might be one thing
That
in
may
the
be
back
an
of your mind to call
indication
for some
to
help.
call an ambulance and get a
Okay.
ride to the emergency room.
Okay. So what do you think it's going to be like after the renovations? People will be, again, you've already been making improvements on how quickly things are getting through. You think that'll expand, that'll go faster? What do you think for after?
I think it will continue to improve. I think having a better flow, having a more open space where we have more area to work, more areas for the doctors to see more patients at a time, will improve how we can move people through.
Well, what's for down the road? Other things that are beyond this, are you thinking about?
For the hospital itself?
For the ER in general?
The ER in general. I don't know of anything else.
We're not looking past, we've got a big thing going on right now.
We
So
do.
we'll get over this hurdle
Correct.
and, okay. Well, guys, thank you very much for being with us, and we appreciate the update on the project and on, kind of emergency medicine in general. We have a health tip for you, so stay tuned for that.
Hi, I'm Dr. David Montag, and I'm here to give you your health tip for today. So we'll talk about earwax problems. It's a common problem that I treat. One of the ways to know you've had lots of problems with earwax is if your ear has kind of a plugged, full sensation with a little bit of decreased hearing. A lot of people tend to have itching in the ear as well. One thing you really want to avoid and not do is put anything in your ear. You want to avoid using Q-tips. It can lead to infections. It can also lead to impaction of the cerumen, which is earwax, further into your ear and make it more difficult to remove. One of the easy things you can do at home if you feel those symptoms is try in a few drops of mineral oil, or you can go to your local pharmacy and you can get some over-the-counter Debrox that tends to soften the earwax and allows it to come out of the ear. If none of those things are helping you and your ear continues to feel full and you have decreased hearing or itching in the ear, then it would be wise to come into the clinic and we can remove the earwax in the clinic, and we could also diagnose if you have some other problem going on other than earwax. And earwax shouldn't be anything that causes pain, so if you have ear pain, something else may be going on. And that's your health tip for today.
Well, thanks for that health tip. We always appreciate those. Joining us now, Holly Wolf. Holly, so you're the foundation director here at Titusville Hospital, and you're going to handle marketing things going forward also. So, well, how's it going? I mean, you're still relatively new, but how's it going so far?
Great. Yeah, I joined in May. The foundation had been kind of 3-year hiatus. Nothing had really been going on with it. We started board meetings in July, brought back some of our old board members, and just had a meeting the other day, and we are up to 10. So
Not just as a guest now, but I'm guessing that there was some excitement to, to really get this rolling again. Is that what's happening?
yeah. So we're really excited to get the foundation back up and going, and we're going to be kicking off the capital campaign for the ER renovations. So that's our big project, and we're excited for it.
Talked to Dr. Newhook and Kim here just a few minutes ago, and they're really excited about it too, from sort of the medical side, that to help them take care of the people faster and all that kind of stuff. Talk about it from the public's perspective. What's it going to be like if you need to be a customer, your family member, your loved one needs to come in?
Yeah, well, they've really been doing great with the clinical initiatives, as I talked about, reducing the wait time. They reduced the overall door-to-dock wait time, so that's the time that the patient comes in to the time they see a provider, by 43%. So, over a year's time, that's tremendous. It's you're waiting in the waiting room, and you're anticipating being seen, and it seems like it takes forever. Might not necessarily, but it feels that way when you're not feeling well. So reducing that wait time by 43% has been phenomenal. So now we really need to look at some other things that have been going on. The patient privacy is a huge one. You're in the waiting room or in a room, and there's a curtain between you. So you might have your child in there is sick with an ear infection, and the person beside you is having a heart attack. So it's hard when there's only a curtain separating you.
Well, also, and you're getting asked all kinds of very personal details, and maybe you don't necessarily want to be telling that to everybody.
Yeah. So our main objective is really that patient privacy, and safety. We're hoping to, as they mentioned, we're doing some upgrades in technology and things like that. We're getting new telemetry units, so that that's all going to help as well. The flow of the ER. One of the ER rooms is kind of outside of the ER, so that's going to be brought inside. We're not technically building out the ER, but we're expanding in other ways. So we're not, we're not going to bump out the building or anything like that, but we're going to be expanding with the space that we have. So it's going to help with our triage area is currently outside the ER. We're going to be moving that. So we're going to be expanding where the ER actually starts out farther, and kind of bringing that in. So it'll be great. Just the whole flow of from the time you enter to the time you're seen should help improve.
So how can I help if this is something that connects with me here? Is there a way I can get involved?
Sure. So we're having the capital campaign. We have a goal of $250,000 to raise. So we're really excited about that. We're able to, if you're a resident, you can go online to titusvillehospital.org. To donate. You can mail to the hospital. You can mail your donations. You can come to the hospital during our week of giving, which is the last week of November. So that'll start from Sunday the 26th, I believe it is, till Saturday the 2nd. All personal donations are going to be matched.
That's like a statewide holiday here for hunting season, by the way.
I know.
Oh, you knew that already.
Oh, I know.
Okay.
Actually, there's a National Day of Giving, so that's why I selected that week. There's a National Day of Giving, and that is Giving Tuesday, and that's on the 28th of November. So that's kind of how
it's like
I
Monday's
picked
just like a
that week.
statewide holiday. So it's good that you didn't do it on the big holiday
Right.
days.
Yeah. So, and actually on that, the National Day of Giving is when we're having our event at the hospital. So that'll be on Tuesday the 28th. We're going to have a wellness day here from 11 to 1:30. We will be having blood pressure screenings. The students from Pitt are going to come over and help with the blood pressures. We're going to have some diabetes experts here, not necessarily giving presentations, but if you have diabetes questions, our employee health nurse is going to be doing that. We're going to be having some lung function testing, and just all of the testing will be free. We're going to have a lady from downtown. She's going to come and do chair massages and things like that, just the mini ones. So it'll be pretty big event, and we're excited for that. You'll be able to donate during that time as well. So
we talked with Dr. Newhook, and I was really anxious to get his answer about this, but when do I see the doctor? When do I go to the ER? So see your doctor, and it doesn't hurt to come out to an event where you can
Right.
get, you can get a checkup for
Yeah.
free and pass that information along to your doctor if there's something that shows
Absolutely.
up. Yeah, maybe you go once a year for your checkup, but it doesn't hurt to come out for something like that, right?
Yeah, you know, to get your blood pressure checked, and we can do your BMI, so your body mass index, things like that, and also your lung function test. We can do that on some individuals if they want that as well. So, you know, all of those screenings are good to have, you know, anytime. So.
I'm with you on that one. Yes, that makes a lot of sense. Okay, so are there other projects that are down the, obviously this is a big one.
Yes.
Other things down the road that you're beginning to think about for what the next one is, you know?
Well, this one is going to last for, you know, quite a while,
Okay.
so that's going to be my main one. But we're hoping to do, you know, starting in the winter time, we're going to be looking at just different. March, for example, is I think it's just there's. Well, let me start with May, or I'm sorry, February. February's
okay.
heart awareness month. So I'm looking at taking those types of months and doing promotions for the hospital based on what type of month it is. So, you know, just trying to help increase awareness and, you know, do you need your colonoscopy in March? Maybe it's not time yet, but just that awareness factor of, you know, this is the national month for that. So, you know, just doing those types of promotions and really trying to make people more aware of, you know, these diseases and that they should have their screenings done.
So I mentioned this to Kim, but we named our show Medicine in Meadville from years ago. We had a program going on that was Medicine in Meadville, and so that made sense. We're not just about Meadville, it's about, you know, all of the Crawford County area. Titusville certainly a big part of that. So when you have stuff, tell us. We'll come over as best we can, and we'd like folks to get to see the experts here too, in addition to the ones on the other side of the county. So, okay. Let me ask you a kind of a big picture question here. So Titusville Hospital, you know, I guess I'll use the words, was struggling for a while. To me, that's changed now pretty dramatically. Let me ask you, am I right about that?
Yeah, we're you know, we're so fortunate to have you know, paired up with Meadville, and we're really doing, you know, a great job. Mr. Clinton started about a year and a half ago, and he's doing a tremendous job, and you can just see, you know, so many changes, you know, from the lobby, and you know, we actually just renovated in here, so we're doing, you know, lots of different. There might be small renovations, but when you look at that lobby, over 50,000 people enter that lobby every year. So when they come in and they can see the changes, and, you know, it makes them realize that we're here to stay and we're not going anywhere.
Things flow a little better, they can
Yeah.
get taken care of. I was impressed, just as I was coming to meet you, the system to get checked in there. Private, you know, not everybody's going to know in the world, you know, what you're here for and all that kind of stuff. So all good. All good.
We're really trying to make the best improvements that we can.
The arrows are
with the
pointing in a
hospital.
positive direction, right?
That's right.
So.
Yeah.
Well, Holly, thank you very much
Thank
for
you.
being with us here
Yes,
on Medicine in
thank you.
Meadville. Thank you to Kim and to Dr. Newhook for being with us also, and thank you at home for joining us, and we'll talk to you next time.